Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Zia Khwaja. I welcome all of you from the MMK Hub for today's lecture of parathyroid pathology. Parathyroid pathology is an important topic regarding theoretical, practical, and clinical aspects. It's the topic for which undergraduate and postgraduate medical students usually don't have clear concepts. So our aim is to clear your concepts and make the subject as simple as possible for you. Now the familial hypocalciuric hypercalcemia. It is the condition which is an inherited disorder that causes the abnormally high level of serum calcium in the blood and low level of the calcium in the urine. Right? People with the familial hypocalciuric hypercalcemia usually do not have any symptoms, and the findings is incidental. You investigate for some other problem, and the results shows the picture of the FHH. What happened in FSH? FHH, familial hypocalciuric hypercalcemia. You can notice on the left side that normally when there is elevated serum calcium, it causes the calcium sensing receptor activation, which we have discussed in the previous slide, that calcium sensing receptors are present on the lining of the parathyroid cells. And when there is the elevated level of the serum calcium, it is sensed by these cells. And these cells causes parathyroid hormone production and cause the decrease in the production of the parathyroid hormone. That activation of the calcium sensing receptors has two effects. One effect is on the parathyroid gland, which causes the decrease in the parathyroid hormone production, and the second effect is on the kidneys, which causes the reduced absorption of the calcium. So there is excretion of the calcium via the kidneys, leading to hypercalciuria, while there is low parathyroid hormone level. But all this happens in the normal condition. In the condition of the familial hypocalciuric hypercalcemia, all this elevated serum calcium do not cause the activation of the calcium sensing receptors. And it results in the high level of the parathyroid hormone and decrease in the calcium in the urine, because kidneys continue to reabsorb calcium. Right. Now, the last entity which we have discussed is the hypoparathyroidism. It is characterized by a peripheral resistance to parathyroid hormone rather than a deficiency. The level of the parathyroid hormone is normal in the body, but there is resistance to the parathyroid hormone action. Patient present with the hypocalcemia, hyperphosphatemia, and raised serum parathyroid hormone levels. It has three types, 1A, 1B, and 2. It is more common in female. Female-male ratio is 2:1. And there is only one prevalence study available, which was conducted in Japan, which shows 3.4 cases per million of population. As far as age which is affected, it can affect at any age. This diagram is summarizing the various types of the pseudo-hypoparathyroidism. You can see in type 1A, there is maternal GNAS1 mutation. GNAS stands for guanine nucleotide binding protein alpha stimulating activity polypeptide. Yes, it is a difficult name, but there is the mutation is this in this gene, which causes the bone and kidney resistance to the parathyroid hormone. In type 1B, there is the methylation defect. which lead to the kidney resistance only. And in type 2, what? Type 2. Yes, in pseudo hypoparathyroidism type 2, there is the paternal mutation in the GNAS gene, and there is the bone resistance only. It's a bit complicated, but we have just to memorize that in pseudo hypoparathyroidism, there is peripheral resistance to parathyroid hormone rather than the deficiency. And what are the biochemical features? These include the hypocalcemia, hyperphosphatemia, and raised serum calcium level, serum parathyroid hormone levels. Thank you very much. If you have any query, you can contact us on our website or a WhatsApp group for any question.